Good evening, everyone, and welcome to our Consultmed webinar. I am Alex Dolezal, Digital Health and QI Team Leader with Central and Eastern Sydney PHM. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize the continuing connection to land, water, and community, and pay respect to elders, past, present, and emerging. I'd also extend that respect to any Aboriginal colleagues who might be joining us tonight. Please note this webinar will be recorded and will be available on the CESPAN YouTube channel within the next couple of days. At the end of the webinar, the evaluation survey will pop up on your screens. We appreciate your feedback. Please complete this to allow us to issue certificates of attendance. Please ensure that you submit your questions to the speakers in the Q&A function throughout the presentation. To view this box, hover over the toolbar at the bottom of your screen. We will answer the questions after the presentations conclude. I'd like to introduce our speakers for the night. Our first presenter is Lindsay Moore. Lindsay is a project delivery manager at Consultmed. Consultmed is an Australian digital health company transforming how care is coordinated across the health system. Lindsay leads the implementation of digital solutions that connect primary and secondary care. She is currently managing the rollout at the Southwestern Sydney Local Health District. Lindsay has a background in optometry and previously worked at the Centre for Eye Health. In collaboration with the Prince of Wales Hospital and Westmead Hospital Clinic, Lindsay helped improve referral pathways and reduce triage wait times. Our second speaker is Dr. Vikram Palit. Dr. Vikram Palit is an associate professor in health systems at the University of New South Wales Medicine and Health, a pediatric respiratory physician and the founder and CEO of Consultmed. Please welcome our speakers.
Hi, everyone. It's great to meet and speak to you all today. As mentioned, my name is Lindsay, Project Delivery Manager and Head of Operations at Consultmed, and also optometrist and based in Southeastern Sydney Local Health District in Kingsford. So I'm really excited to present to you today. I can see there's a few people who've arrived so far, and I've been informed that there are quite a few GPs, practice managers, referrers from both within the district and also outside of the district that are here today. So the aim is to introduce you to Consultmed, talk about how we can use Consultmed to improve referral pathways and how we can make your referral processes easier through integrations with our software and your practice management softwares. So with that, I will share my screen. And we'll start with some slides first, and then I know that there's quite a few people that might be interested here to see the best practice integration, among other things. So once we've gone through the slides, then we'll jump straight into that and go from there. Thank you, Alex, for the lovely introduction as well. As mentioned, Consultmed is a digital referral management pathway. Some of you may have used Consultmed in the past before to send your referrals either to Sydney Children's Hospital Network or maybe outside of the district, say to Southwestern Sydney Local Health District. Here we go. For today's talk, we've got a few objectives that we'd like to go through. So one is to help you understand how to use Consultmed to send both referrals and requests for advice and guidance. We'd also like for you to understand how to use best practice and medical director integrations within Consultmed to improve that efficiency when referral writing. We're going to go a little bit through the use of advice and guidance to help manage your patients in your primary care settings with some specialist input. And also, I'll briefly show you our external patient portals which exist for some of our clients. There we go. So as mentioned, we're a digital referral automated workflow platform. The aim is for us to connect primary care providers such as GPs directly to both specialists and hospital networks. It's really easy to create a Consultmed account by visiting our website, and it is free for GPs and other care providers to send referrals, and will always be free to send referrals. So our website's just listed here, www.consultmed.co. And when you join, you'll also be sent a welcome pack, which shows a very nice how-to guide in terms of setting up your account, adding other doctors if need be, and also the integrations, which we'll go through later. So within the platform, we include referral tracking and notifications. So when you send a referral via Consultmed and it is actioned by the receiving specialist or healthcare provider, you also receive a secure notification to let you know the update of the status of that referral or request, as do you have the option to allow for your patient to receive similar tracking and notifications so that they can be kept up to date, as well as yourself. We do also provide advice and guidance, which I will go through later. And we do have options for consent patient engagement within our referral systems. In terms of where we are now live across over 15 hospital networks and LHDs, and there are 55,000 healthcare providers now using Consultmed. Because of that particularly, we've made sure that we do have coverage for GPs and primary referrers with regards to practice management software. So we have integrations we've worked quite hard on with best practice and medical director, as well as with specialist coverage with Gen 2, Palcare, and MediRecords, which is about to go live with us as well. And we will be integrating as well with My Health Record from April 2026, which should make that referral process much easier as well. We started in Sydney Children's Hospitals Network in 2022. And this has steadily grown throughout the life of Consultmed so far. So now we have 4 local health districts that are using Consultmed to send and or receive referrals, the largest of which being Sydney Children's Hospital Network and also Southwestern Sydney Local Health District. But we also work with PHNs, particularly in their Medicare mental health referrals in certain areas as well. So those are receiving referrals and providing the ongoing care as well. Let's go on to something that I think everyone will be quite interested in. So this is our integration with BP Premier. We're enabled via Halo Connect as a BP partner. We've worked quite closely with our GPs as consultants to set up this integration and make sure that the integration itself aligns nicely with your workflows as what you would normally be doing when, say, creating a template on best practice. We've now initiated the updated Halo Connect connection. So all you need is your site ID and pairing code to set up best practice. And the good thing is with best practice, it's actually set up on a server level. So that means if you can get your practice manager involved, they can set it up once, invite all of the doctors to join, and then the integration is up and running for everyone. At the bottom here, I believe you'll be receiving the slides after this webinar. So we have links for our installation guide, setup videos, and how to send a referral with best practice as well. And this is also given to you once you create a Consultmed account in an email as well. We also have our integrations with Medical Director Clinical. So Medical Director, we use their smart sidebar. So that is actually set up within the practice management software itself. You click the Consultmed icon and you're actually able to send a referral on Medical Director itself with the patient open on the side, and the information itself will pull across as we go through. And just like with best practice, we have installation guides, setup videos, and videos on how to send a referral that all get sent to you when you sign up with Consultmed. And Although we have these integrations that are present, we are also conscious that not everyone will have practice management software that can be integrated. There's obviously quite a lot of practice management softwares that exist. And for that reason, what we also have is Consult Pilot AI. And Consult Pilot AI, it's not like your Heidi scribes or things like that. It's set up to be able to transform your unstructured text into something on Consultmed in a structured format and be able to send referrals. More importantly, if you have a paper or a PDF referral, you're able to, or other types of documents, you're able to upload that onto Consultmed and have the AI format your text into all of the required spaces. So it saves you a lot of time entering patient information and putting the data that you have in a pre-written referral that you might use your unintegrated software templating to put that onto the system itself. And the last thing I wanted to speak about was advice and guidance. So as an optometrist, sometimes I might have a patient and I'd love to have a specialist opinion, but I'm not entirely sure if they need to be booked in for a consult to be seen. And as we know, especially with their hospital waitlist, sometimes they can be quite drawn out. The advice and guidance concept allows for you to receive information, a specialist opinion back for your patient in a very timely manner so that you can actually better manage your patient within your practice with that specialist input. What's quite good about our advice and guidance as well, because it comes through Consultmed, it means that there is a record that is kept for that patient, and that increases your clinical governance as well as the secure messaging pathways back and forth in terms of getting that information. So I won't go into this slide too much, but just mention to say that the evidence is there that the advice and guidance process that we have is effective in reducing that patient wait time and also improving patient outcomes. In SCHN, we have 2 clinics that provide advice and guidance, dermatology and pediatric neurology. And our research showed that with the use of this advice and guidance within Consultmed, there was an average reduction in unnecessary patient visits. Patients were actually showing up, or more patients were showing up for their appointments. And importantly, there's that great improvement in referral response time and appointment scheduling. So meaning that the patients who really need the care can receive their care in a timely manner. And as a referrer or a requester for advice and guidance, it means that you can receive that information as to how to manage your patient within your primary practice in that timely manner as well. Okay. So that's most of our slides out of the way. So from here, we're going to jump straight into that demonstration. So I just wanted to briefly show you, it's quite easy to log in and set up your account. So here I'm just at www.consultmed.co. And if I want to create an account, I simply type in my work email address. And just add a secure password. Here we go. And we do make sure that we fit all of the security requirements because we do have patient data that's involved. We've got multi-factor authentication as well. But I'm going to stop at this page. I just wanted to point out that we accept all different role types, including that of practice managers. And that's quite important because I know everyone's really busy. Sometimes you might have a referral you'd like for your practice manager to be able to upload it on Consultmed and send it on your behalf. We do have that capability, but also the capability for practice managers to be able to manage their clinics. So when doctors come and go within your practice, that can be managed by the practice manager rather than eating into your patient time. So from here, I'm going to log in as a GP. This is what you can expect to see from your dashboard when logged in on Consultmed. So you can see here I'm part of a few clinics, but I'm going to select an apple a day clinic. This clinic in particular is integrated with best practice, so that I can show you that best practice integration in person. This is our staging environment, by the way, as well, so no real patients in this section either. On the left, you can see there's quite a large button, Create New, and I can select this to create referral letter or send an advice and guidance request. I also have an inbox, so this will show me any reports that might be sent to me, perhaps from a specialist. And more importantly for you as referrers is our outbox. It's set up like our email. So any referrals that you send go into this submitted section, and then the status will be updated based off how a receiving specialist or healthcare provider will triage your referral. So as the referral itself is acknowledged, accepted, scheduled, returned, it'll move into these boxes as well for super easy tracking. On the right as well, we have our settings. So if you ever need to update any user settings, your signatures, practices that you're part of, you can do so here. And this one here is quite important. This is an admin portal, and that allows for practice managers to manage any users, so everyone can be part of the same practice. A short note before we go to sending a referral: if you do need any assistance with setting up a practice, or if you would like for your practice manager to do so, we strongly encourage you reach out to us. We're more than happy to help you with the onboarding process and getting everyone set up so that we're all ready to send referrals nice and simply and easily. So let's start by sending a referral. And I might just quickly bring up my best practice as well, so that we can see a little bit about what that looks like. So here I'm just using our virtual machine, and I would like to open my patient. Here we go, Alan. So let's say Alan has come to see me, and he's got an interesting papilloma, say, on his eye, and I would really like for someone to have a look at this papilloma, but I'm not sure if it requires referral, maybe due to the size or something like that. So what I can do from here is, let's just bring that one back up. I can send an advice and guidance request. So here I'm going to, on our right, we have our filter by categories. So this shows any of the healthcare organizations and networks that are available accepting referrals through Consultmed. You can also filter by type of service, as well as specialty and professions and a few other things. I'm just going to clear the filter for now, and I'm going to send a request for advice and guidance to Consultmed Test Department. And here I can select my specialist as well that I would like to receive this request from. Now, this next step is quite important when it comes to integrations. So this is where we upload our patient details, and this is where the options open up for how we want to pull across our patient data. So you can see here we've got our Consult Pilot AI. I'll show you that one a little bit later. But what we would like to do is, you can see here we have this integration with best practice that's set up, and we can import our patient data. So here we'll type in our patient's surname, and let's grab his date of birth. And we'll search. And here what it's done is it's searched through best practice, and it has actually found our patient. So what we can do here is import our patient details. I've actually imported some patient details for this patient in the past before, so I can select registered, or I can create a new patient. And now this is showing you all of the information that has been pulled directly from best practice, so saving you heaps of time in trying to enter in all of that patient information, and increased accuracy as well. Of course, we can make any updates to the patient details should we require. So I've just added gender identity there. But you can see here all of the patient information is pulled across. Any unique identifiers or MRNs that are part of your best practice get pulled across as well. Healthcare card information, and also primary and secondary contacts as well. So it's quite thorough in terms of all of the information that it pulls over. Following this, we would then move to our advice and guidance request. So this here is a customized form specific for dermatology. Other specialist clinics might have their own specific requirements that they would like, but here, type in, say, large papilloma, covering vision, query management. Please advise if a referral is required. This is essentially just writing your request. Why are you sending this request in for advice and guidance? And we'd select the request type. So we would like an opinion. We do have options to request for if telehealth might be useful, or if the patient perhaps requires an interpreter. You can also add any additional information you would like. And this specifically asks for any additional information about the lesion to help the person specialist reviewing determine the information they need to be able to accurately send back information and advice. From here, we have the ability to fill in any details about the patient in terms of do they have any family histories, previous sunburn, and this section is quite important. So this allows us to, again, import clinical data from best practice for this patient. Let's give it a moment. Oh, yeah, it's having a think. Lovely. While this is uploading, we also have the option to add some images, so we can import attachments from best practice direct in this section, or we can also do that later. This particular one asks about CPD points and patient consent, and as I mentioned, all quite modifiable in terms of this. So when sending a referral, you may notice there's a similar pattern to all referrals or requests for advice and guidance, but some of them may have additional information that they would like to receive. So here we now have the ability to import files direct from best practice. So instead of having to download those files and then re-upload them back into Consultmed, we do pull information from a number of different folders within best practice itself. So investigations is one of them. So say this is imaging. We've got some correspondence in. Perhaps you'd received a report from pathology previous to sending a request for advice and guidance. Maybe there are some clinical images, and typically we do pull from the first 6 months, but you can also extend that if you would like to see any additional tests that might be a little bit older. Here. So let's just say imaging here. And then when ready, we would select import attachments. And so that's just importing there. And you can see those attachments have been added to our request. We also do have the option, say particularly for a skin lesion, if you want to take a photograph of it while the patient's in front of you, we have this option where you can use our QR code. You can take the photograph with, say, your phone or the work phone, and instead of it storing on the work phone itself, it'll upload directly onto Consultmed along with the other images. There we go. All right, and if all else fails and we've still got additional files that we also want to upload, we have that as an option as well. So here we go. Say I wanted to drag an image just from my computer. I can do that too. So many different options to always fit whichever pathways or workflows that you have in your practices. We provide all of those there. The last step is our summary. So this then shows everything that we've gone and uploaded here. So our patient information, care or guardian information from our first page, who the sender of the request is, the receiver, and our advice and guidance request there with our information. And of course, we've got all of our attachments as well. So you can always open these, and this is what the specialist will see when they're reviewing it. They have this great viewfinder where they can select back and forth between different images and make their expert judgment, and then be able to send that request back. Or of course, if it's a referral, book in patient for their appointments and effectively triage that referral. And then the last step is our tracking and notifications. So here, this will send you as a sender any updates of the status of that referral, so that or request. So whether the request is accepted, if it's been returned, or if we've converted that request into a referral itself. And you also have the option to involve the patient so that the patient can receive those notifications as well. This one particularly is for sharing of personal information. So as you set up your Consultmed accounts with your own email, you might wish to not have your own email attached to the referral. If you leave this on no, it will select the clinic's email address and contact details rather than your own. There we go. And then we would submit. And once that has submitted, it does take a little bit of time on my machine, but it will go into your submitted folder in your outbox. And as the request or referral is actioned, it will go into all of the respected folders. But what is quite useful about the integration itself as well is, and let's just exit out of this one. When we go back into our patient, like I said, sometimes it does take a minute. When we use the integration, the referral or request document will actually go into correspondence out folder, where you can then review. And once the referral itself is actioned, let's just jump out of that one quickly. Any correspondence will go into this unchecked inbox and then can eventually be assigned into correspondence in. So here's one that we've prepared earlier to kind of show you what that all looks like with your documents there. Okay. And let's see if that one has caught up now. Here we go. Just department advice and guidance. And here we have it here. So the next thing that I wanted to show you is sending a referral without that integration, but it should make things clear with that referral process. And I'll point out while we're showing you where all of that integration information would come in as well. And then the last step will be to show you medical director. So we'll get to see how each of the integrations work separately. So here, this time I have a different patient. I'd like to send a referral to a specific department. Again, I'll pull up my categories. Let's just say for this example, I'd like to send to Southwestern Sydney. And I'd like to send to a diabetes clinic. So here we go. I'd like to send to diabetes and endocrinology, and I would select my healthcare provider or no-name specialist, whatever it might be. And for the purpose of this, let's pretend I'm not integrated, and instead I've got my digital, my document that I would like to use. Instead of using the integration, it's simply a matter of drag and drop and select transform. And so what this is doing, in a similar manner to how our integration worked, it's actually reading through the information, and it is structuring that information in a way that is going to make it easier to upload all of the required information to our referral on Consultmed. So here you can see it's uploaded all of our patient details. Because it is AI, we still do recommend performing all of your normal manual checks just to make sure information is in the right place, for example. So here, just update that quickly. And we can also update any information that might be missing, just as with our best practice integration. So here it's pulled my patient contact information quite nicely. And this is moved to our referral form. So just like with our best practice integration, we can select this transform button. And because it's read through our information, it's pre-populating all of the required fields there. So patient has type 2 diabetes, it's poorly controlled, and we would like for this patient to be, say, seen in the clinic for a medical review. I would then go and select the required criteria. There's a note that's left for me to attach certain images and pathology reports, but you can see here that AI has already just pulled all of that information across to a nice structured way that's going to be easy for the receiving specialist to view and action, as well as saving you heaps of time in having to put this in individually yourself. From here, just as before, we move to our attachments and we can upload any attachments as required. And as you can see, the process more or less from here is quite similar. We're just agreeing to say, yes, we've done all of our checks. We've made sure the information that has been entered is appropriate. And just like with our integrations before, we've got our summary here with all of our information in it. And the original referral that we used to fill in this information is actually attached with the document itself. Now, the last thing I wanted to show, I've been informed there are some practice managers here who do sometimes send referrals on behalf of their doctors. We have this additional option to add a message. And typically with practice managers, if you are sending a referral that one of your doctors has printed and signed, you can add a message. So this referral is on sent from Dr. John Smith, provider number 1, 2, 3, 4, 5, 6, A2. There we go. And what you can do, particularly if you've got lots of doctors, you can actually save this as a template. So Dr. Smith. And then it means that the next time around, you can actually just select this button, Dr. Smith, and apply. And then this information will show up for you really, really quickly and really easily, just to help with that additional amount of support when specialists are receiving your referral. We've also included, you've got my signature, which is at the bottom here, and my name as a doctor. And when you create your accounts, there's an option to add your signature and your provider number, your credentials, etc. And then that information does show up automatically with each referral that you send, so that you're not having to sit there and sign multiple documents and having to put this information in manually yourself. We go to our final step. And here, because it is a referral, I can specify my referral period, and I can also request a notification if my referral itself is due to be renewed. and that will send me a notification, say my patient's been accepted and scheduled for an appointment in a hospital, and it's close to expiry for that referral, rather than having to wait for a call from the hospital or have your patient show up needing that additional referral. You'll get that email notification, which will let you know that it's ready to be renewed, and you'll be able to follow your normal processes for what you would do for renewing that referral. Here, tracking and notifications, exactly the same as with the request for advice and guidance. And then we would submit. And as with our request for advice and guidance, it goes into the submitted section. And as it's actioned, then you will receive a notification to let you know that it has been actioned. And you'll also be able to see any advice and guidance that comes back from those actioned referrals. I'll just briefly show you what that looks like. So here's one I've prepared earlier. And here I didn't really give too much for the advice and guidance, but this is where your advice for how to manage the patient would appear. And you can see here it's linked in with your best practice as well. So this also will show up in your unchecked inbox and then into your correspondence in as well. And you can also see the referral itself that is listed below. Okay, so now that we have that covered, I've just got one more to show you. And this is our integration with Medical Director. Just for the sake of having to share multiple screens, I've actually had this one pre-recorded as a video, and I'll just talk you through the process so that you can see what it's like. Again, it is quite similar to our previous ones, but this one is within that smart sidebar that is on Medical Director. So over here, you can see we've opened up the dashboard on Medical Director itself, and you can see the Consultmed smart sidebar widget that is visible on the right, just with that little icon there. It's just showing that if you would like to keep it there, you can hit the little pin button and then it'll keep it open for you. Because your patient is open on the screen, it automatically finds your patient as well. And here we're just selecting which clinic we would like to refer to. So say we've selected general outpatients. And you can see here automatically we've got test patient on the left, Mr. Patient Test. And without even clicking a button, that information is already visible in the referral from Consultmed on that smart sidebar widget. And it is, again, like the best practice integration, pulled all of the relevant information from your patient file in Medical Director. And here we're up to our referral form. So we can enter our primary diagnosis or presenting complaint in a similar fashion as before. So this one, for example, is asthma, and a little bit more detail about that reason for referral. You can also specify your urgency. And you can see here as well, without clicking a button, all of your patient history from your patient file has transferred over. You can actually edit this as well. So if there is some information that's not relevant, you can also remove it. It's not set in stone. Here we have the availability to import attachments from Medical Director itself. So here we have a number of different folders. So this one is letters that we're showing. But you can see here we also pull from results, documents, ECG folders within Medical Director. And you can select all of the relevant files you wish to attach to your referral. And you still have the ability to drop and drag anything that's outside of Medical Director along with that referral too. This shows you the preview. So that's everything that we have entered while creating our referral. So all of the medications, our images, all of that has transmitted there. You still have an option to add a message as well, just like what I showed you previously, and the ability to select the referral period as well as request automatically renewal notification as well. And in a same fashion, once a referral is submitted, it automatically goes into correspondence out on medical director. And once a referral is actioned, it goes into the inbox and then into correspondence in as well. So with that, that covers all of our referral and advice and guidance request options. So if you would like more information and all of those options still don't work for you, we do also have the existence of patient portals for some of our larger clients. So Sydney Children's Hospitals Network and Southwestern Sydney Local Health District, for example, both have external patient portals, and I have included the links in this slide as well for your own use. And the ability, or the reason why we have these, is so that, say a patient you don't have time, the patient's got a referral on a piece of paper, and they want to be able to self-refer to some of the departments with these hospitals. They have the ability to, by visiting this portal, which is essentially, it's an external portal. It's a standalone, so that patients don't have to create accounts. They can upload the referral that you've written and be able to send it in to the respective clinics without necessarily having to go back to you and ask later on down the track. It's important to note, though, that not all clinics accept patient self-referrals, but some of them do. And if you are in a pinch, we do have this option that's available. So I'll just show you that one as well. So this here is an example of the Sydney Children's Hospitals Network portal. So here you can see they have Children's Hospital at Westmead referrals or Sydney Children's Hospital Randwick. And you can select from specific departments or services which receive those self-referrals as options. So here they have a general outpatients. And this is where the patient would be able to fill in all of their details, similar to what we showed you in app, obviously without that integration. But they can fill in their own details, their own concession healthcare cards, carer guardian information. And this is where they would upload who has written the referral for them, so namely yourselves, general practitioners, specialists, self-referrals, etc. And then they would put in their reason why they would like to be seen. They can write C referral if they would need, and they can upload their referral either via mobile or via a drag and drop situation there. And again, they can elect to have tracking and notifications as well set up for both you as referrers as well as for themselves. And once they have submitted that, it goes into the same place as where any in-app referrals will go, so that it can all be triaged by the receiver in the one place. Okay. So from here, let's just pull up my slides one more time. The last thing I wanted to go through was just about where to find help. So we've included different ways that we can be contacted, and we are always happy to assist you if you've ever got any problems or would like any assistance with any of what we've discussed today via Consultmed. One of the places that you can go is within our app itself. So over here, let's just jump out of that. In Consultmed itself, we have a little help button. So you can select that, and here we have included a number of our frequently asked questions surrounding how to update your settings, how to add doctors using the admin portal, information about software integrations. We also have a number of useful videos that are available for you to go through, so that you can follow something as you are sending a referral for the first time or updating your settings, whatever it may be. And if all of that is still not answering your question, there is a help desk that is available that is in-app. We respond to this very quickly, and you can select your reason for wanting assistance, add your details here. You can request a callback. And when you submit, this comes to us and we aim to respond. We usually say within 4 business hours, but generally we would try to respond to that much faster. And then we also do have our contact us website. So say you're having some issues logging in, for example. Then you can visit www.consultmed.co/contact, and you'll still be able to fill out that same form and send us a request for assistance. There is also, as I mentioned earlier on in the talk, the availability of quick reference guides that are sent to you when you first sign up with Consultmed to also further assist you within the process. Okay. So that has covered everything I was hoping to, with showing you what is Consultmed, how to use it, and we may pass on to some questions. I'm happy to answer a couple that we have already received, just to set the scene, and hopefully this will also open up for other questions as well as we go through this question time.
Thank you, Lindsay. So I'd like to ask anyone who wants to submit any questions to use the Q&A button, the Q&A function. I'll be monitoring them and I'll read them out once they arrive. In the meantime, Lindsay, feel free to pursue those questions you received earlier.
Brilliant, thank you. Okay, so I wanted to set the scene. There have been some questions that have come to us before, and I'm hoping to give you some updates regarding those as well. So something people do sometimes ask us, particularly with best practice integration. I know everyone likes to have that button on best practice and be able to launch launch Consultmed directly off the best practice screen. At the moment, you would still log in to Consultmed and you would send a referral through that integration as I demonstrated today. However, there is always a question, why can't I have a button? And our answer to that is that we are actually in discussion with best practice, and we are fingers crossed hoping that this functionality will become available in the near future. And of course, we will provide some updates as the development progresses. In the meantime, I usually suggest setting up Consultmed as a favorite in your browser so that it's really quick to be able to launch and find rather than having to go through your Google searches and things like that. And then the other question that we do sometimes receive is that the receiving hospital is not acknowledging the referral that I've sent. So that's when you send a referral and it just sits in your submitted folder. It doesn't go to under review or accepted or returned. And what we do usually recommend in this case is to contact that relevant clinic directly. We are always in discussions with our clinics, particularly like Sydney Children's Hospitals Network and South Western Sydney Local Health District, and they really do appreciate your feedback. So we just encourage you to reach out to that clinic if the referral itself has not been actioned, and then they should be able to assist you there as well. I can see something's popped up in the chat.
We do have one question, and it is regarding how do we know which specialists use Consultmed for referrals?
Do you mean specialists within a hospital clinic or independent specialists?
It does not specify. So
Okay.
if you could specify if you mean private specialists or hospital clinic specialists, please.
I think it's popped in already.
Just let me have a look. Private specialists.
Private specialists. Okay. So we do have quite a few private specialists that use Consultmed to send referrals, but not necessarily receive them. And we do have other specialists that are also listed to receive referrals. If they are listed to receive referrals, then they will be in our directory. Again, this is our staging environment, but when you select referral letter, you can select specialist clinics. And then the clinics that do receive referrals will be in our directory. So you can do that by searching by typing in their name. Or what you can use is if you're looking for a specific referral type, you can filter by categories. And say, for example, you wanted a clinic that sees children. Sure, here we go. Here we go. So you want a clinic that works in pain medicine, for example. You can apply those filters. And then when you select a new directory, that'll be a lot more condensed, so you'll be able to see which specialists refer. You can do this in a similar manner to hospitals and healthcare networks, but for those private specialist clinics, that's the way to go.
And just to add, there are several thousand specialists in that list as well. So we're kind of at the point now where the directory has actually expanded so much that we need to reorganize it and make it easier to find the private specialists. It's a bit easier with the public hospitals, obviously, because they come in under the banner of the hospital they're in. So we are actually working on improving the private specialist clinics, so it's kind of easier to show which clinics are around, which ones are near you as well, all those things. Kind of like what some of the other vendors do as well, HealthShare, Doctify, things like that. We're also working with them.
Thank you, Lindsay, and thank you, Vikram. Another question is, I practice in Cesspling catchment, but I have patients who live in the southwestern Sydney local health district. Will I have the functionality to use the referrals to hospitals in Sydney, southwest Sydney local health district like Bankstown?
Yeah, absolutely. So with Bankstown and Bankstown Lidcombe Hospital, they are planning to go live. I've been advised around the late April stage. They don't have an exact date, which is why they haven't sent out communications. But for all of the other hospitals within the district, so Fairfield, Camden, Campbelltown, and Bowral District Hospital, they are already live and receiving referrals. Please reach out if you are interested, particularly for Bankstown Lidcombe Hospital, and we'll make sure that we can send you communications once they have a more solid go live date. But that will definitely be happening very, very soon. And Liverpool will follow as well.
Thank you, Lindsay. Another question which came through is Consultmed directed more to hospital clinics rather than private specialists?
It's both. I think some of our larger clients are hospitals just because they have a lot of referrals to manage. But even within Consultmed, the ability to send a secure referral is there, even if the specific specialist you're looking for is not in the directory as well. So
and I think just with that as well, so the hospitals get onboarded, like Southwestern and Sydney Children's, like you've seen, and then all their departments are essentially there. But those consultants actually, as you know, work private as well. And on them setting up their account in the public system, they often almost certainly set up their private account as well. So if you know, say, a pediatrician at Sydney Children's, and you know that you most likely will find them in our private drop down as well and see where they're working. So it's catered for both. And the idea as well is obviously you've gone to the effort of setting up an account in order to send a referral to Sydney Children's, for instance. So you should get as much utility as you can out of it. And so absolutely you're able to send referrals to any of the private providers. There's Medicare Mental Health, there's 6 PHNs that use Consultmed. There's a variety of telehealth providers, telederm, telepsychiatry. So there's no restriction on who you can send referrals to once you've set yourself up.
Thank you. Thank you. One more question. Can you provide additional information regarding the My Health Record integration? Is that for clinician without the software such as best practice? And will this allow to view documents or also to upload?
Yeah, so we're about to, hopefully around May, we're doing compliance testing at the moment, which, as you can imagine, takes some time, but we'll go live. And so basically any service that signs up to that additional module with us, the referral that you either send or on the hospital side you receive, if you have added on with the My Health Record feature, then that referral will automatically upload to My Health Record against that patient. So we will absolutely, in the system, once that is live, you'll see that come live. And then if you want to sign up to it, you can. And that way, if you're currently having an issue with getting your referrals and reports and stuff to My Health Record, I understand best practice and medical director and things do that. But if you're using other systems that don't do that, or you need it for whatever reason, we'll be able to upload that referral to My Health Record automatically. And we're also doing letters, reports, and discharge summaries as well.
Thank you. Thank you. If there are any more questions, please paste them in the Q&A function. We still do have a little bit of time, so I would encourage any attendee to ask a question. Okay, I believe there's no more questions. So thank you, Lindsay, and thank you, Vikram, for your presentation. I would like to remind attendees to complete the online survey that will pop up in your web browser. If you have any additional questions, please reach out to us, and we can pass them on to Lindsay and Vikram and they can respond to you. I would also like to remind all attendees that we have an interactive e-referrals to the Sydney Local Health District and SR Specialist and Referral webinar on the 4th of March 2026. We look forward to seeing you online soon. Thank you and goodbye.
Thank you very much.
Thank you.